Good morning. This is the anatomical lecture course, and today we have the last lecture in the current year. And my name is Professor Dmitry Starchik from Human Morphology Department from Northwest State Medical University, named after Mechnikov. Today we continue myology, and our task is to discuss the torso muscles, and I also going to remind you muscles of the neck. Unfortunately, I couldn't see anybody in the chat, and nobody online. Oh, yes, thank you. I see Bardik Mahrabi. It's nice you join us today, because it is not interesting for me just to record the lecture, and that is not right. That's not all right if students couldn't come and join the translation. Patrick, please let me know, is everything correct with the translation? Can you hear me clearly? Or I don't know, maybe there is some problem with translation. Yes, thank you, Patrick. And if you are present, then let's start our lecture. As I said, this lecture is about torso muscles. So today's topic is torso muscles. What is a torso? As you see here, the torso is the part of the body, and this part doesn't have a head, neck, and limbs. So this is the central and the most massive, the biggest part of our body, and it has a lot of muscles which can be divided at the back muscles located on the dorsal surface of the body. That is thoracic muscles located in the upper part of the torso, and the abdominal muscles, which located lower, and they form anterior wall of the trunk of the torso. Trunk is another name of the torso. And we are going to discuss, and I'm going to explain you anatomical building, anatomical feature of the diaphragm. Diaphragm is the muscles between the chest and between the abdominal cavity. Let's get started, and I would like to say that the torso and trunk have some aesthetic aspect, because it forms the attractive quality and attractive view of the body. We can evaluate the beautiful of the body just also with the torso muscles. And of course the knowledge about torso muscles is interesting not only for doctors and surgeons, but the artists, sculptors, and in other professions dealing with the art. They should know the correct position and correct form of different muscles. It is interesting that doctors can see some details of the body which are not visible and for other people. Like if you see here, this is the special the suture or the position after surgical operation. I think this beautiful girl has appendectomy, and it stay visible. Okay, some of the functional aspect about trunk muscles. We would say that muscles located on the trunk provide different kind of movements, and especially with the spinal column. This girl is famous Russian gymnastic Julia Guntel, which she has unbelievable movements in spinal column, and it is also possible with the trunk muscle function. These muscles support posture and plastic, and of course the group of muscles have the special athletes and gymnasts try to develop these muscles, because they are it's very useful for the special type of the sport. Of course, trunk muscles form the walls of the chest and abdominal cavities and help internal organ function. For example, the breathing is possible thanks to the chest muscles, to thoracic muscles, urination, bowel movements, and childbirth. This process is they are managed by the abdominal muscles, and most of the muscles of the trunk in anatomical from anatomical point of view, having the static and strong muscles. They have myons with a lot of muscle fibers. Such muscles we call them static muscles, and this is the red so-called type of muscles. Some of the clinical aspects, there are some of the clinical aspects in trunk muscles anatomy. The doctors usually assess the development of the child, examining the trunk muscles, and they sometimes we see hypertrophy or hypertrophy of the muscles, which is the symptoms of some of the wrong development of the muscles. And we doctors should know how examine abdominal muscles, because during palpation, during the trying to understand the position of abdominal organs, and we have to know how relax abdominal muscles just to touch and palpate. This palpation is the in other words touching, when we use our hands and try to press the abdominal wall and understand the organs which are located behind of the anterior wall. And this is a skill which you will use in the clinic in our university when you come and join to the university. I hope it will be very soon. And as I said, doctors assess the asymmetry of the trunk, and I hope you understand that is a result of the wrong development and so named anomaly, their pathological position of the back. Like here you see S-shaped scoliosis of the vertebral column, and it is also the result of the wrong muscles development. Okay. If we are talking about development, so you have to know how trunk muscles form, how they were formed during the embryonic period of life. And as you see here, this is a picture of cross-section 4 weeks embryo, where we see the all embryonal layers, like ectoderm, like endoderm, as it is a gut tube, primary gut tube, and here also you see the neural tube formed from the ectoderm. And between the neural tube and the surface ectoderm layer, we see the group of the tissue, of the embryonic tissue, which we call somit. And the somit has the somit has the dermatome, myotome, and sclerotome. And myotome is the group of embryonal tissue which transform in the muscles then. But sclerotome is the group of another mesodermal layers which form bones. So myotome and sclerotome are developed from the parts of somites here. And then as you see cross section of the 5 weeks embryon, here we see that the myotome forms the more massive part, and then it divided into the dorsal and ventral group of the muscles. Like epimere is the dorsal part. It's located here dorsally, but some of the group tissue immigrated or moved to the ventral position, and we call it hypomere. And then from the dorsal group, epaxial muscles forms all muscles of the back or dorsal muscles, and it is innervated by the dorsal branches of the spinal nerves. And more the biggest development has a group of muscles located anteriorly or ventrally, ventral muscles, and they form all muscles located on the chest and on the abdominal cavity, as well as the anterior group of neck muscles, which we discussed last lecture. Here is the 8 weeks embryon and organizing group of the back muscles, and some of the layers, usually 3 layers, abdominal muscles located anteriorly, as well as the most anterior located muscles which form musculus rectus abdominis. Here is another way of another point of view, another picture with the muscles, myotomes or myotomes located on the body of the embryon. And here you see occipital, usually 5 somites located on the close to the neck. Then cervical somites also. This is these 2 groups is embryon thos of the neck and occipital muscles. Here is thoracic somites, lumbar, usually 5 somites. As you see, it is the same quantity of the somites which is equal for vertebra of the quantity of the vertebra, and sacral also 5, and a lot of coccygeal somites. By later they are reduced till to the 2 or 5 somites with the muscles. And here is another source of the muscles located on the head is the branches or the arches, usually 5 arches. Here they are blue, which forms head muscles, masticatory muscles, or and muscles of the face. Some of the muscles on the neck forming from these arches, and usually, for example, the trapezius muscles form from these embryonic branches. But another myotomes transform in the back muscles located here, and the chest or thoracic muscles and abdominal muscles, as well as from the anterior myotomes form the limb of muscles, which we will discuss next lecture in the new year. Dorsal muscles classification is very simple. The group of muscles located on the dorsal body part and developed from the dorsal myotomes we call back muscles. This is a group located on the dorsal surface. Another muscles located on the ventral body part we would call the thoracic muscle. This is a group muscles located on the chest, abdominal muscles, as well as the diaphragm. Only muscles located between chest and abdominal cavity. Let's start from the muscles of the back, and we also will discuss the fascia and topographic formations, the main topographic formation. I explain what I mean. This is the group of the regions or areas located on the back, and usually we distinguish the central located two areas, vertebrate area and sacral area. Sacral area is located under the vertebrate area, and this is usually narrow area which located just in the projection of vertebral column. So in other areas there are 4 areas just located the one under another, and the superior position has suprascapular area. Then in the projection of the scapula is the scapular region, subscapular region located just under the scapular, and the lowest the inferior position has lumbar. Uh, uh, I hope you remember that the borders between the neck and the back go through the line connecting the acromial process of the scapula and processus spinosus, or spinosus process of the 7 cervical vertebra. Inferior border goes on the pelvic bones, and this is the crest of the ilium, and on the dorsal surface of the sacrum or os sacrum. Back muscle classification is also easy to understand. There are superficial muscles or groups of muscles which have origin from the upper limb, and sometimes not only for limbs, but it also join the ribs. They have fixed points on the ribs, and usually these muscles, superficial muscles, move the upper limb, or sometimes they move ribs. And there is the deep muscles group, which located just close to the vertebral column, and we divide this group on to 3 layers: superficial layers, intermediate layers, and deep layers. It's important to know classification the back muscles by its origin. We distinguish ventral origin muscles. Usually they innervate, and the understanding of origin or development usually it helps to understand innervation. And as you see, the ventral origin muscles innervated by anterior branches of spinal nerves. The dorsal origin muscles innervated by posterior branches of the spinal nerves, and only 2 muscles of the on the back we have only 1 muscles, which is the which is formed or developed from the branchial arches, and that is the trapezium muscles. And as you see, it is innervated by 11 pair of cranial nerves. So let's see some of the muscles, superficial back muscles located posteriorly. Here you see the trapezius muscles. This is the musculus trapezius in Latin, and I just talked about that. Trapezius is formed from the branchial arches. It's formed on the firstly it's formed on the anterior arches and just immigrate to the back region, and it has also it's innervated by 11 pairs of cranial nervus accessorius innervates these muscles. This is a quite strong muscles which located superficially to other group of back muscles, and it start from the processus spinosus of all cervical and thoracic vertebrae, as well as this is the point where it fixed to the cranium, to the occipital bone, and the fixing point is the scapula. It in the this is the spina, scapula, and acromion. Usually, when the trapezius contracts, it move the scapula posteriorly, and the inferior fibers, inferior fascicula of these muscles rotate the scapula, but during the fixing the upper limb gird, when the scapula is fixed with the other muscles, for example, when we use the hands and just fixed them on some of the supporting material like chairs, or like the bed. Usually patients fix their arms on the bed, and then it's possible to move the vertebral column in the cervical region on the neck, and these muscles is also move the head back. We flex the neck and head posteriorly with the trapezius muscle. Another muscles located just under the trapezius is the muscles we call musculus latissimus dorsi, or this is the latissimus dorsi. This is the point, and this is also broad muscles which start from the processus spinosus of sacral and lumbar, and even six processus spinosus of six inferior thoracic vertebra, and the fascicula of muscular fascicula connect together and join to the humerus, the crista tuberculi minoris. These muscles help to move humerus posteriorly, and this extend the humerus in shoulder joint, and move the arm behind of the body. usually the athletes taking exercises on the gymnastic taking gymnastic and hang on the metal tube. Usually these muscles help us to hang and move our body up when we making such exercises on the gymnastic snarets or the elements. Then we see also the levator scapulae muscles, which move the scapula up. Rhomboid muscles, the minor and major, they are located between the spinal between the vertebra, processus spinosus and scapula here. And there are two serratus muscles. We call it posterior serratus, but there is serratus superior. This muscle is located under the rhomboid muscles, but here we nicely see the serratus posterior inferior. All these two serratus muscles connect spinal vertebra with the ribs, so we call these muscles like breathing muscles. They are breathing and in breathing. The group of the deep back muscles located along the vertebral column and the superficial layer of the deep back muscles includes the splenius, two splenius muscles. We distinguish splenius capitis here and splenius cervicis. As you see, the origin of splenius muscles are the spinal processes spinosis of cervical and thoracic vertebra, and the fixing point of the splenius capitis is the superior lateral part of the superior nuchal line located on the occipital bone, and for the splenius cervicis, those are the transversal processes of cervical vertebra. I hope you guessed that splenius capitis and cervicis they move the head and cervical vertebra, the cervical part of the vertebral column posteriorly. It's flex the neck posteriorly. The biggest, I think this is the biggest muscle of the back, is located usually in the inferior part of the back, and we see very strong muscle we call with the name musculus erector spinae in Latin, or this is the muscles which usually erect vertebral column, or make the our torso unflexed, move in the unflexed position. And there are three muscles in erector spina. The laterally located musculus iliocostalis, which start from the os ilium and fix to the ribs. Then the intermediate position takes the longissimus or musculus longissimus, and the medial position takes musculus spinalis. This is located just close to the spinal processus spinosus in the back region. Next, intermediate layer forms the large muscle we call transversospinal muscles, or musculus transversus spinalis. Different part of these muscles form the large group of muscular fasciculus, and the typically the transversospinal muscles start from the transversal processes. You see these points, and then it go medially and fixed to the spinal process, and the superficially located the long group of the fibers, muscular fibers, we call semispinal, which has three parts: capitis fixed to the skull, then cervices fixed to the cervical vertebra, and thoraces which connect the spinosus transversus to the processus transversus. And just under the semispinal muscles located multifidi group of muscles. Usually they are shorter, and usually it start and go past them two vertebra, and they have obliqual direction of the muscles, but the deepest group of the transversospinal muscles is between the processus transversus and located just up another vertebra. I hope you get that semispinal muscles usually works as a erector, or it flex extend the vertebral column. Multifidi muscles work as extender and rotate, but the deepest located rotators usually rotate the vertebral column to the opposite position. And regarding the deep layer, we see muscles located between transversal and between spinosis processes spinosis, and they are good visible in the vertebral column regions, which are quite movable, like cervical department and lumbar department. And also the deepest group of the posterior muscles connect them transversal processes with the ribs, and this is the this group of muscles used by breathing, because they move ribs up and help us to inspire to make inspiration. And the deepest group of the neck muscles located posteriorly is between the first and second cervical vertebra, called atlas, and between axial vertebra. Here you see the rectus capitis posterior minor and major, which connect the minor connect the posterior process tuberculum of the atlas and atlantis, and the major connect the occipital bone with the processus spinosus of the axis. And two oblique muscles, the superior obliquus capitis superior, between atlas and occipital bone, and between the first and second cervical vertebra, located also the obliquus capitis inferior. So this is there are four deepest located short muscles we call nuchal muscles, or this is the deepest group of the back muscles. What about the fascia? Fascia located on the posterior part. We distinguish superficial fascia. It is located just under the skin, and we call it subcutaneous fascia. And propria fascia, or this is own fascia, which is a layer of for all group of back muscles, and we distinguish the three layer of this proprial fascia: posterior, middle, and anterior layers. They it's here is visible all of the layers of the fascia. I mean proprial fascia. This is a posterior layers which cover the superficial group of back muscles. Here you see the middle intermediate layer of the muscles located on the back, on the dorsal surface, and form the layers for the deep group of back muscles from the posterior side, and the deepest layer, we call it anterior layer, is it covers the anterior surface of the back muscle. So there is three layer of proprial fascia: anterior, posterior, middle, and anterior. Here there is important topography structure located posteriorly, and this is important for point of forming the hernia, or the some appendices coming from the abdominal cavity, and we call this topographical structure lumbar triangle. This is the gap between the latissimus dorsi muscles and external abdominal muscles, and the inferior border is the iliac crest. This is a point for which usually surgeon examined because it may be site of the abdominal hernia. Usually it's located here. And another topographical area we call triangle of auscultation is the gap between trapezius and latissimus dorsi, and the doctors usually use this point to auscultate, or trying to hear breathing sounds with the stethoscope. This is an instrument of doctors, and usually we put the stethoscope on that position, and we can then we hear the breathing sounds very easy. Next group of muscles is the chest muscles. Firstly, let me show you the borders between neck and chest, and it goes the superior border is goes to the clavicular and ends on the jugular incisura on the sternum, and the lower border go horizontally through the base of xiphoid process. And here in the chest region we distinguish six areas. The central position takes pectoral region, which located just anteriorly to the sternum. Then we see sorry, it's mistake. I call the number 3. It's a mistake. We have the number 2 is the pectoral, but number 3 is the presternal region. Here is presternal region. Pectoral region is the projection of the pectoral mire muscles, and just under the clavicular we distinguish infraclavicular fossa. Axillary region is the anterior wall of the cavitas axillaris. Inframammary region and lateral pectoral region, it is the lowest located area of this of the chest. Chest muscles can be classified to the muscles attaching to the upper limb bones, and these muscles come to the trunk, come to the torso from the upper limb, and they immigrate to the body from the upper limb. But another group of muscles attaching to the ribs and taking role in respiration, we call Aune group of the chest muscles. So as you see, all pectoral muscles or chest muscles by origin they have ventral origin developed and innervated by anterior branches of spinal cord. What muscles are in the upper limb muscles? We call it also the upper limb girdle or pectoral girdle of muscles. Of course, this is the pectoral major, the large muscles located superficially, and it starts from the clavicula, from the sternum, and even from abdomen, and connect to the crista tuberculi majoris, and usually these muscles adduct the humerus in shoulder joints and extend and flex the shoulder joints, and usually a lot of men like to form these muscles and make it bigger, because it it gives the good such men usually are good looking men because of this muscle. Under the pectoral major we find the small pectoral minor, which start from the third, fourth, and fifth ribs and connect to the coracoid process on the scapula. And these small muscles moves the scapula anteriorly. The small muscles of this group located between the clavicular and the first ribs, we call it subclavius muscle. It is really small. And the fourth muscles in this group we call serratus anterior. I hope you remember we have serratus posterior muscles, superior and inferior, located on the back. But there is also serratus muscles, anterior serratus muscles located on the chest region. And chest muscles attached to the ribs take its role is to produce inspiration and expiration. What kind of muscles taking role in expiration? This is the external intercostal muscles. You see that here. And also the subcostal, it's not right. This is the group of expirate muscles. Subcostal, let's say that subcostal muscles and internal intercostal muscles, as well as the transversus thoracis muscles. Those three muscles are muscles of expiration. So we inspirate with the external muscles, but the internal intercostal muscles make expiration. And there is three fascia of the chest. First one located under the skin. It's usually we find this fascia subcutaneously. In women, it covered the mammary gland, and this is the all of this is superficial fascia. Then own fascia, propria fascia, covers the muscles of the thoracis, like pectoral major, and here you see that this is a superficial layer, and a deep layer of the fascia form the pectoral minor, and the thorax layer is cover the external intercostal muscles. Two of these layers, superficial and deep layer, form axillary fascia, which cover serratus anterior muscles here. Two important triangles located on the chest and this is the clavipectoral triangle between clavicular and musculus pectoral minor. In the projection of pectoral minor, we have trigonum pectorale or trigonum pectorale, and the lowest position has the subpectoral triangle. All of these three triangles used just to understand where branches of subclavian and axillary artery forming, and this is usually important for surgical operated on this position, especially for plastic surgeons. Diaphragm is the large and broad muscles located between the chest and abdominal cavity. This is the muscles developed, which was developed from the neck myotomes, and then it come down and take the position in the lower aperture of the chest, and this is of course the muscles of the breathing. The main role of the diaphragm is the breathing. As you see, the diaphragm has the central part we call the centrum tendinum or central tendon. This is aponeurosis. I hope you remember that aponeurosis is a broad tendon of some of muscles, and diaphragm has such tendon. We call it central part or central tendon. And there are three muscle connections we call the muscular part of the diaphragm, and it depends, the name of this muscular part depends on the bones it fixed. For example, sternal part of diaphragm connect the central tendon with the sternum. The largest part of the muscles, fibers or fasciculi, connect the centrum with the ribs, and the strongest, the most fibers, muscular fibers having the largest thickness, with it's quite thick group of muscular fibers, we call lumbar part of diaphragm. And diaphragm has some apertures with for the blood vessels. For example, here in the centrum you see the foramen vena cava or vena caval aperture. Then there is the esophageal aperture. Here the esophagus passes through the diaphragm and connect another thoracic part of the esophagus with the stomach, and the inferior aperture is the aortic aperture, which is for the standing aorta, and this is a point or border between thoracic part and abdominal part of the descending aorta. This is the largest This is the largest arterial vessel in the body. Here you see different muscular part of the diaphragm, and the smallest one is the sternal, the broadest is the costal, and the strongest is the lumbar part of the diaphragm. Between the parts of the diaphragm, we find small triangles, and this is the weakest part of the diaphragm. And I would like to add that the esophageal aperture is also a weak point of the diaphragm, where may be formed the hernia, stomach hernia, when the stomach passes the diaphragm and come in the chest cavity. And the latest group of muscles we have to discuss today is the muscles, fascia, and topographic of the abdominal region. Firstly, the border of the abdominal superior border is a horizontal line through the base of xiphoid. This is the border of the this is the lower border of the chest, and for abdominal, the lower line is the inguinal ligament, the projection of inguinal ligament, which is between the iliac crest and pubic symphysis. Here we distinguish 9 regions, but firstly we divide the abdominal cavity on the with the three region: upper abdomen, mid abdomen, and lower abdomen. The upper abdomen and mid abdomen have the line passes the point of 10 ribs. This is the ends of the 10 ribs, and this is the horizontal line which forms the upper abdominal. We call another one the epigastrium in Latin. Then the low line goes to the through it connects between right and left spina iliaca superior, anterior superior, and so we see in this position we see the upper abdomen, in other words, is epigastrium. Mid abdomen, in other words, is mesogastrium, and lower abdomen is named hypogastrium. And each of these two floor or two etages of the abdominal cavity has the three regions, three area: central and parietal area in the superior to upper abdomen is the epigastric region. Then there are two hypochondriac region, left and right, in the epigastrium. In the mid-abdomen, we distinguish the umbilical region and two paired lateral region. And in the lower abdomen or hypogastrium, we distinguish the inguinal region, right and left, and just up to the pubical symphysis, we find the pubic region. All of these regions are important to know to examine abdominal organs and find their position in this area. Classification of abdominal muscles is also not difficult to understand. There is the anterolateral group. This is the first group of muscles, and the second is the posterior group, located posteriorly. The anterolateral group is the group with a lot of muscles located. We find broad muscles and long muscles. For example, one of the long muscles is the rectus abdominal muscles. But broad muscles usually located laterally, and we have three layers here with the external abdominal muscles, internal abdominal muscles, and the third layer is the transversal muscles located here. Good visible the external oblique muscles, then is internal oblique muscles, and here you see the transversal muscles here. Musculus rectus abdominis or rectus abdominis has some of intersectiones tendinous or tendinous intersections. This is a border between different myotome forming rectus abdomen. We find small pyramidal muscles which form the connection between linea alba and the pubic bone. The posterior group is quadratus lumborum muscles, which is between the iliac crest and 12 ribs, and this is the muscles which make strong the posterior wall of the abdominal cavity. Abdominal fascia, there are three fascia here. Superficial, we call another, this is another name, subcutaneous fascia. Individual or proper fascia, also like in the chest, it has three layers: superficial, intermediate, and deep layer. And it's very important fascia located from the inner side of abdominal cavity and cover all abdominal walls from the inside, and we call it endoabdominal fascia. It has different name, which is connected of its position. For example, the endoabdominal fascia cover the transversal muscles we call transverse fascia. It also covers diaphragm, iliopsoas muscles, pelvis, and the even is the fascial layer for the square muscle of the lower back. If you are going to be a surgeon, you have to know the weak points of the abdominal cavity. This is, of course, the inguinal channel and umbilicus area, where is also point for forming the hernias, and linea alba. Linea alba is a structure which is formed from the aponeurosis of the external or lateral muscles. Here you see the canalis inguinalis, inguinal canal or channel, which forms a gap, slot-like space between the inferior position of the abdominal, and it contains the spermaticon in man body, but the round ligament of the uterus for female. So because the testis or muscular gonads passing through the abdominal cavity, the abdominal inguinal canal in male inguinal canal is having the larger diameter than in women, which contains only round ligament. And usually this is the two opening of the inguinal canal, the superficial annulus and or opening, and deep opening located inside. And you also have to know the walls of the abdominal cavity, abdominal inguinal canal, and that is the aponeurosis of the external or anterior wall is aponeurosis of external oblique muscles of the abdomen. Usually the inguinal canal is the point for forming inguinal hernias. It may be obliquous hernia when it comes oblique, and it starts from the deep annulus and ends in the superficial annulus. But it is also there is also the rectus or right hernias in this area, which come just through the abdominal wall and form the hernia. Linea alba is also the weak points of the abdominal wall, and as I said, this is a fusion of the or crossed fibers of aponeurosis of broad abdominal muscles, and usually the linea alba is thin in upper position, just between the xiphoid process and umbilicus, and the lowest part is ceca, and hernia located mostly in the superior part of this one. And also rectus sheath is the special pocket for the rectus abdominis muscles, and it formed from the aponeurosis. Usually they form linea alba here, you see, linea alba, but also form the pocket for the rectus abdominal muscles. And I have to remind you the neck muscles. We distinguish superficial layer. This is the sternocleidomastoid muscles and trapezius muscles. I hope you remember that trapezius muscles is a part of it is a superficial muscle of the back, and middle group of the muscles connect to the hyoid bone with the mandibula and with the sternum, and some of the group deep muscles of the neck located anterior to the vertebral column, and the lateral group connect the first and the second ribs with the processus transversal. So and we distinguish also three fascia in this region: subcutaneous, own fascia for muscles, and endocervical fascia, forming the covers for internal organ of the neck. This is all for now, my friend, and I am open for your questions. I see today today 9 students. That's fine. You found the time to visit our lecture, and I prepared the test for you. This is only there are only 5 questions in the test, and it's open now. Don't forget to pass the test till the end of the day of today, and that's all for now. And if you have questions, as usual, send me your questions by emails. And let me thank you for your attention, and I'd like to congratulate you with the coming new year, and let me wish you to be healthy and to be successful in your studying. I hope you will join us in the next year. I see questions. I don't understand. What do you mean, Ashkan? My answers in Moodle. You have to pass the test and just click on the test, and then start to answer for questions. Where you find my email, I let you know my email. This is Dmitry Starchik and cgmu.ru. Please, if you have question, don't hesitate to let me know by email. Okay. Again, I recommend you just to pass the test, and hope to see you in the just after the New Year holidays. We have holidays till the 9th of January, and the next lecture will be in January. Thank you for your attention. Have a nice days and have nice holidays of the new year, my friends. Goodbye.